Hi, I'm Megan Norman, and this is a new series called Made for Minnesota Moms. I'm a mom of three and a Minneapolis newborn and family photographer. I'm hoping for real conversations with Minnesota women who support pregnancy, birth, and postpartum, sharing resources that you can actually use because the internet at 2 a.m. can be a lot. Today, I'm with Dr. Britt Stamer, a registered naturopath doctor who helps women with hormones, digestion, autoimmune issues, and more, with a special focus on fertility, pregnancy, and postpartum. Dr. Britt, thank you for being here.
Thank you so much for having me, Megan.
I'm so excited for this conversation. I'm excited for all of them, but this one in particular because I will give the disclaimer that I see Dr. Britt and she's helped me quite a bit. So I'm very excited about this. So could you explain what you do to someone who has never heard of a naturopath?
Yes. So, a naturopathic doctor is a form of integrative medicine, which I think is something that people might have heard of in that world, but it really kind of combines holistic medicine when we're talking about nutrition or herbal medicine or lifestyle medicine with the best of pieces of conventional medicine. So lab work and diagnostics and imaging and all of those pieces. And so we try to bring all of those things together to really focus on root cause medicine. So finding what those pieces are that are impeding your health or impeding your life and giving you symptoms.
Well, and I would say what I think is really awesome about naturopathic like for you is that you're treating me as a whole. You don't just focus on their pregnancy or the quote unquote issue or thing that they're dealing with at the time. You're asking so many questions about who they are and what has happened in the past and what's happening right now, and just treating them as a whole, which is just a different, in my experience, has been a very different time with a doctor.
Yes, exactly. It's very individualized medicine. So even though a woman might come in and they might have very similar symptoms, I'm wanting to know their particular constitution. What kind of things might have set up those symptoms, right? Or what kind of, things happened preconception wise or during their pregnancy. It's all very unique to that person. So I try not to just focus on symptoms and really focus on the entire person and all the things that are going on in their body, mentally, emotionally, physically, all of it.
It's such a refreshing way, in my opinion, on how to treat someone. It's not just a Band-Aid. It's figuring out everything because everything works together in our body. So it's very cool. Okay,
Yes.
so when should a new mom consider working with you?
Yeah. So my preference is that I see them preconception. So pre-baby, that would be my ideal. 6 months preconception would be my ideal. And the reason why is because we can set up so many good health systems so that they have a healthier pregnancy, they have a healthier postpartum, baby's healthier. So that would be my ideal. And then I get to support and have that continuity with people too, because sometimes I think that you can have pregnancy providers and postpartum providers and, all of those pieces, but I kind of like to have a touch point with them the whole time. So it feels really safe for them too. So yeah, I would love if I could see every mom right away, before pregnancy even begins. But if they come to me postpartum, they can come to me at any point. I love to work with moms postpartum, from a couple of days after birth up until whenever, because your whole life is really postpartum after babies.
True. That is so true. So what tends to surprise new moms or anyone when they start working with you or a naturopath doctor?
Yeah, I think people are really surprised at the amount of time we spend and the amount of care we give.
Yes.
So yeah, I have a pretty small practice, and that's on purpose. I love to get to know my patients and really care about them. Yeah,
We
good.
feel it. We do.
Good.
We do feel that. Yes.
Good. Yeah, so I'll remember your partner's name and your kids' names and all the trips you went on and all of those things, and including, all those things, but all your health history too. So I think they're really surprised at the care that they get and the quality of care, because we really do care. I really care about how you're doing and how you're feeling. And I'm a mom myself, so I feel like always incorporating that into my treatment plans too, like making them really easily digestible for people is something that I think is surprising too, because either they think it's going to be too overwhelming, they're going to have to change everything about their lives, or they think that it's not helpful at all, right? Depending on like what kind of information you're getting. And I think I always try to meet patients where they're at, give them something that's really easy for them to incorporate into their lives so that they feel better. And then I think knowing that I care and spending a lot of time, because my visits are pretty long too.
Well, and I think that's probably a big shift. Like we're also used to quote unquote Western medicine where we have only a short amount of time and we try to ask all the questions, get everything in, boom, boom, boom. Where I feel like every appointment I have with you is not rushed. It's like very thorough. You're making sure that I understand what it is that you're recommending, why you're recommending it. And for me, particularly, knowledge is power. Like, so for me, understanding why I'm doing those things for the overall goal of, what we're trying to work on, it just makes it so much easier to want to do those. Because I will say I saw a different naturopath before you, and she was wonderful, but it was a different experience than I have had with you, where with you, I feel like we just have this connection, and you do care. Like I feel that you care, and then I also understand all the steps as to why we're doing the things. And so it makes it easy to do those because you make sure that I understand why. It's just a different experience, and I definitely recommend it to anyone who's never experienced it before, because for me, I just did your quick 15-minute consult call, and that was enough to hook, line, and sinker, and we've been together ever since. And so
Yes.
if you are interested, like if that is something that you're interested in, I would wholeheartedly recommend just popping onto that 15-minute call with Dr. Britt, because it's like the most seen I'd ever felt in 15 minutes. So it just was wonderful. So I digress, but
Well, you're very kind, and thank you for those sweet words. I appreciate them a lot.
Well, I mean that. I mean it. So, okay. So I guess what are some misconceptions that people have about working with a naturopath?
Yeah, and I think I touched on them a little bit, but I think either people think they're going to have to overhaul their whole life and it feels just too overwhelming to start, especially if you're postpartum with a new little baby. That can feel really difficult. Or I think some people think that it's not worth it. Like there's nothing to find here. And that's why I like to tell people that there is a lot to do, but we always make it where you're at, right? We almost never run out of options of things to look at. The human body is wildly complex to make you feel better, but I always try to make it so that I'm meeting you in a place where it feels like you can implement those things in your life to feel better. On that point too, I always really love to do a lot of lab work with patients. So even though I'm like always listening, taking in what you're saying about your body, because you've been living in that body for, 20, 30, 40, 50 years. So that's the best information really. But I also love to do a lot of lab work. So I think sometimes postpartum, women just feel tired or they feel a little bit anxious, and that's kind of considered quote unquote normal with having a new baby. And I like to not ignore those things and make sure that we're working them up in some way to help people. So like listening and lots of lab work, it's kind of this really unique combination that I think people don't know exists. I think they think there's maybe like this holistic approach or this conventional approach, and really there's a unique melding that naturopathic doctors do.
Yes. And I do, like you said, I think that we as moms so often dismiss how we feel because we just are like, oh, we're tired because we had a baby and we're awake all the time. I will say I 100% did that with all three of mine. And it wasn't until there was some other things that were presenting that I was like, no, this is not just postpartum. And yes. And I also think as moms, we put ourselves on the back burner so often. And so to prioritize ourselves, to understand that we're going to be a better mom and to be able to take care of our kids and even set healthy examples for our kids about taking care of ourselves and our health is so important too.
Yeah, exactly. And like I talked about with, thinking about preconception, and that helps in pregnancy health, and that helps in postpartum, and helps in your future health too. Our pregnancy gives us a unique picture kind of like what maybe some of our health tendencies are going to be when we're older too, and postpartum does as well, because we're in a sleep deprived state. Our bodies are just in a transition state, and sometimes we can see like, does that mean that diabetes is on the horizon maybe for me postpartum or in my future? And so I always like to think of people in their whole longevity too. So even though we can push down symptoms sometimes, it's really nice to get ahead of them too, to make sure that people are feeling good long after they have a baby, for their entire life.
Well, yeah, and that goes back to you seeing us as a whole and looking at the whole us and not just these things that are happening at that time. So,
yes,
which
exactly.
is wonderful. Okay, so I guess what does a postpartum visit with you typically look like?
Yeah, so if we have our first visit postpartum, that would be my first visits are always an hour and a half long, which might seem like a really long time, but it's very necessary so that we can talk about all the things from your health from birth till now, how your pregnancy went, any health issues you started with, things you're feeling right now in all different ways, and so that we can get a really good picture of where we should start. Then based on us talking, I'll look through old lab work if you have any from the past couple of years. I love to see that to kind of get a jump start. We make a plan based on that hour and a half visit. And then in about 4 to 6 weeks, we'll meet again. And that's usually after we get some lab work done, maybe some imaging. You try the treatment plan and see how you feel, and then we keep building on that. So what I usually do with patients I have already seen through pregnancy is that we usually meet at 6 weeks postpartum, because then we kind of get a feel for how have things been going? How is baby sleeping? How are you feeling? How did birth go? How are you treated? Like all of these different pieces. And then we usually get some lab work at the 6-week visit is kind of my ideal. Because what happens then is in conventional medicine, usually 6 weeks is the last time you see your prenatal or pregnancy provider. And so I want to make sure we don't just leave you after that 6 weeks, right? As we all know, 6 weeks is just the beginning of having a baby and parenting kids. And so I always like to have that touch point of like, I'm here when that care ends too with your prenatal provider to make sure that you're still being cared for.
That makes total sense. That makes a lot of sense. Just to have that support, that added support. And I think too, what is nice that I've learned is you do have that hour and a half appointment, like your initial visit, but then you have it structured depending on how much time you need when you revisit. So we've had 15-minute calls. We've had 45-minute calls. Again, it's that meeting us where we need you. And I appreciate that. I don't feel like you're wasting my time or billing me for more time. In fact, I feel like you're always very gracious with your time, because we do become friends, right? Like you do have that connection with someone and you do want to know what's going on because yes. So I love that. And I guess what would you say, like how would it go if someone came to see you? So you want to see them before they can see you. So what does that treat or route look like?
Yeah, that trajectory. Yeah. Also to touch on that, having a small practice, I really get to know my patients. So I feel like if they feel cared for, compliance with plans is better. They feel better. I enjoy the care. I enjoy the relationship better. It makes my job more fun. And so I always like to treat it like that rather than a business, transaction.
No, I feel exactly the same way. I wish all of my clients could be my friends, and I think they are, because you want that connection because that makes them feel comfortable and it's just natural and authentic, and it just
Yeah.
feels good.
Yeah. And it makes your job much more fun,
Way
right?
easier
Yeah.
and
More
way more
relaxed
fun.
on your
Yes.
end too. Yeah,
Yes.
exactly. But if patients were going to see me preconception wise, I love to see people at least 6 months before is kind of my ideal. Because when we're talking about sperm and egg health, usually take about sperm takes 3 months from being made until that's ready to become a baby, basically. And same with egg health, 3 to 4 months for that egg, that DNA is kind of opening basically and being more exposed. And so that's about 3 to 4 months before it gets chosen to be the ovulated egg, basically. And so that window of like 3 to 4 months is really, really important, and giving us a little buffer room on the back end for changes to be made and supplements to be started and lab tests to be done and kind of those sorts of pieces. So I love to see people a minimum of 6 months ahead of time.
Okay. And you know what? I should touch on that I found really interesting when I looked at your website when I first reached out was you even help women who are trying to get pregnant that maybe haven't had as much success. And so you help them with that as well.
Yes, exactly. So yeah, I do a lot of infertility work and people who are struggling with fertility issues. And so trying to figure out those pieces. And sometimes it's patients who are going through IUI or going through IVF, but it's sometimes patients who want to avoid that, or some patients who've just been trying for a few months and want to see and dig a little bit deeper. Because a lot of times what we see conventionally is that those options aren't given until people have been trying for 6 months or a year. Nothing is investigated. And then a lot of times they just are overridden. And that can affect your health in pregnancy or health of baby. So I always like to try to investigate those pieces because everyone's outcomes will be better.
I think that's awesome. It's
Yeah.
awesome. Okay, so what should someone look for in a naturopath doctor?
Yeah. So in Minnesota, there's a little bit of a difference. And I don't know if you know this, but anyone can basically put up a sign and say they're a naturopath.
I didn't realize that.
Yes. And so you want to look for someone that's a naturopathic doctor and has that ND behind their name. So that means they went to like 4 years of a science undergrad and took prerequisites. They went to 4 years of a naturopathic medical school. They possibly did a residency, all of those pieces. So,
Okay. Okay.
yeah, so you want someone to have that kind of full knowledge base so that they can order labs, they know how to interpret them. If you're on medications, they know exactly how they work. They can maybe prescribe those medications in different states, actually. So they're very familiar with kind of all of those conventional pieces, diagnostic pieces, pathophysiology pieces, but their goal is always focusing on holistic care, root cause medicine, individualized medicine. So I think that's something you absolutely should look for. And then if you're looking for someone that you want to see for women's health or, anything pregnancy and postpartum, you really want to look for that's part of their specialty, that they've taken extra trainings in those pieces, that they are, that they know that care really well. That's a patient population that they see. Because while other doctors can be fantastic, other naturopathic doctors will know the basics and still be great. You want someone who's really an expert in that field.
What inspired you to kind of go into that specialty?
Yeah. So when I was in school, I was actually training to be a midwife. Yep. So I've attended, 40, 50, I lost count, births before.
Awesome.
Yeah. And so I really thought I wanted to be a midwife. So I loved that time of like preconception, pregnancy, postpartum. But I realized that my constitution wasn't built for it. A lot of late nights and being a mom, it's a little tricky. And while it was really my favorite part of school, I decided, how can I be part of that world without having that type of schedule? And so I was like, how can I support women and moms in a different way? And so I kind of segued into the fertility space, and I've decided to become a doula just for my patients. So it's like a much lesser load than being a midwife.
That's awesome. Even more of a one-stop shop.
Yeah, exactly. So I've decided to kind of be in that world in a different way. Like, how can I support them? How can I support that patient population? So that's how I
That's
got there.
amazing. That's
Mhm.
so cool. Okay. I didn't even
Yeah.
know that. That's awesome. So I asked Dr. Jessie this question and I loved it. Was so interesting to hear her answer. So can you share one powerful moment from your work that you'll never forget?
Yes. I have a few of them together, but I actually might share two. When patients who have been struggling to get pregnant and they get pregnant and maintain a pregnancy, possibly after like multiple losses or loss, and we figure out some of the pieces that have been missed, there is no better feeling than getting a message like, we got a positive pregnancy test this morning, right? It's like, it's the
Yes.
best feeling. um,
Yes.
so, and to be like a small part of like all the changes that they were empowered to make and they did themselves feels really amazing. So that's one big thing that I love in my practice. And then the second one, I've had a few patients who started seeing me after their second baby or after their first baby, due to, lots of different issues that came up that maybe were brewing in pregnancy or preconception wise. We've made changes, we've addressed them because they might not have been, something that they felt were big enough to address first pregnancy.
Yeah.
Because you can kind of ignore that when you're not
Oh,
parenting.
100%.
Yeah.
Yes.
Yep. Or even when you're
100%.
parenting.
Yes.
But we've addressed them and then they've had a better pregnancy, like less anxiety postpartum, their thyroid's more stable postpartum, like all these pieces that really rocked them after their first baby because they didn't pay attention.
Well,
And
and
no
I
one
don't
and no one
think you
asked.
know. Yes.
And no
I
one asked.
honestly,
And no one cared
yes.
to ask. Yeah.
Yes. I
Yes.
don't think you realize it until you go through it and then you start experiencing these things and you either write them off or you start asking more questions. And in my experience, they couldn't answer the questions or they didn't take the time to answer the questions, which just left me in this weird state. And so finding you who actually listens, sees me as a whole, and we've actually been able to solve a lot of things. It's taken trial and error, but but just taking the time to address them and talk about them because again, like you said, you write them off because you don't know.
Like this could be this could be normal, or no one said it was a big deal,
Yes.
or yeah, no one had an answer for it. And so I think seeing women with like their second baby and feeling so much better and having way more capacity to take care of themselves and their kids and put themselves first, I think is one of the best things too.
Yeah.
Mm-hmm.
Well, even me not seeing you during my pregnancy and seeing you after my three, and us figuring some things out, especially more recently, it's very strange to have lived a certain way and then all of a sudden realize, no, you could have had more energy, or you could, like for me, it's my thyroid. So like my thyroid numbers could have come down. I didn't necessarily need all the extra, so it's just this like fabulous aha moment that I think we just write off because we just think that's how it should be.
Yep, exactly. Because you're supposed to be tired postpartum, or you're supposed to
Yeah.
be a little bit anxious because you have a new baby or something like that.
Yes.
So they get written off pretty easily, which they
The,
shouldn't be.
right. Yes. Yeah. Okay. So is there anything that you want to share or anything that you want to talk about?
If patients want to find me, they can always find me on my website. Yep. BrittStamer.com. Pretty easy to find me. Or you can email me at drbrittstamer@gmail.com. And I have lots of resources there too. You can learn more about my practice. So hopefully it feels really accessible. And like Megan said, there's a great 15-minute phone call that's free so that people can ask me questions about how I practice for their specific conditions they might have or their symptoms, and try to get some answers on how I could support them specifically.
I would highly recommend doing that. It's 15 minutes and she's going to be super honest with you and upfront about it. And I did it because I was like, sure, 15 minutes. And then for me, I've been working with you, I think, for 2 years now. And I could not speak more highly of my experience, my care, everything. So much has come to light that I never realized was an issue or should have realized was going on. And I recommend Dr. Britt quite a bit to other people. And I think that everyone can feel my energy of around how wonderful and just, yes, it's just a different experience that I hope everyone can have, because it's just nice to actually feel like someone sees you as a whole person and doesn't just look at certain things and band-aid them. It's like, getting everything balanced out so that you can be the best you can be for your kids and for your spouse and for yourself.
Yeah, exactly. I couldn't have said it better.
See, I'm very passionate about Dr. Britt, and I love that she can help, from at any point in your life. So before, like she said, like before you start planning to have a baby, or during, she's going to meet you wherever you're at and really care about who you are. And it's just this wonderful feeling to have someone like that on your side that can answer all the questions. So if you can't tell, thank you for being so fabulous and wonderful.
Thank you
so
as
appreciate
well.
you. And thanks for taking the time to answer all these questions and to just go through everything.
Absolutely. It's so fun to be able to chat in a different capacity and share it with so many people. So thank you very much.
It's wonderful. Also, I feel like, can we plug your tea at the end here? Because I know that it's like a passion project on the side.
Yes.
But I have
Let's do it.
purchased some, and I gave some as gifts. And so not only is she a fabulous naturopath and a wonderful mom, but she also has, tell us more about your tea just at the very end, because I think it would be interesting.
Yes. So I have an apothecary. It's actually called Naive Apothecary, which I'll share a little bit about how I chose the name too in a minute. But I make teas and flower essences, bitter herbs, elderberry syrup, lots of different herbal and energetic products. So it's a bit of a passion project. It's a slow burn right now, but working on it on nights and weekends and things like that, nap times. But I recommend a ton of herbs or flower essences or things like that in my practice. So I wanted to be able to create my own formulas that felt that they were needed for my patients. And also I really want to help people focus on the art of slowing down and being, yes.
She's looking
like
at
brewing
me
a cup of
because
tea.
I need, yes, I feel like totally primed is to just keep moving, but it is that's so smart.
The like art of slowing down and having to brew a cup of tea or connect with nature in that way, right? We live in urban jungles and those sorts of things, and we don't get to connect with nature very much a lot if we're living in the suburbs or the city or something like that. And especially sometimes in winter, we like hunker down inside. I think finding small ways to connect with nature, which I think herbs are a really great way to do that. So that was kind of my goal. A lot of people don't connect at all with herbal medicine and things like that in that way. So that's why I decided to do it. And then I chose the name Naive because there's, the mainstream definition of naive that everyone knows, but I wanted it to be a little bit of a play on words because there's an alternative definition if you look it up. And basically it's living with a lack of artificiality and living with intentionality.
Interesting.
Yeah. So you can look it up. It's a very kind of a unique play on words, that it doesn't have to be a bad thing. It actually can be a really positive thing, like living authentically, living, without that artificial sense, living in nature and that sort of thing.
Very cool.
Yeah. I also chose it because I got called naive a lot when I was younger for being like kind of like an idealist. So
yeah, but look at where you are now.
Mix. Exactly.
I mean,
so I took a spin on it.
We all have our role and our purpose, right? So, and you have found yours. I can 100% say you have found yours. So I think that's cool. And I have bought tea. I did it for the holidays. I bought 3 bags and I gifted 2, and both of those people have raved about it, and then I drink it as well, and it's just so nice to know where it comes from, and like everything's listed on there, and it's just
it's organic too,
delicious,
and
it's really good.
Yeah.
So all right.
Awesome.
So I just had to plug it in there because
thank you.
But
It should be
yes,
up on my
well,
website soon. That's the hope.
Okay, good.
Yeah.
Okay, good.
Mhm.
Okay, good.
Yeah.
All right. Well, thank you for taking the time to chat and talk about how awesome naturopaths are and what they can do for us.
Yeah. Thank you so much, Megan. You're the best.
Thanks. Right back at you. Thanks for listening. And now for my quick disclaimer, the part I have to say out loud. This interview is for educational and informational purposes only and isn't medical advice. For guidance that fits you, talk with your healthcare provider. Thanks for listening to Made for Minnesota Moms, and I can't wait for the next interview.